fine over there, extra fine than zero point 0.5 or 1.5 GTech. Hello guys, hello. Are you still there, people? Are we still doing good over there in each of our end, wherever planet you came from, or this time around? Okay, guys, please confirm na ba si slide?
Na
Na,
sir.
Yes, sir.
okay. Wait sa guys, saan naman? Wait, how many are you na ba here in this meeting? Let me check. Wait, why is not showing all the participants? There. Only 30. Like any updates from the others? Initan? What panahon are you referring, Initan? Like because of weather? Because of poor weather conditions. Okay, so to those who are not aware, okay, here in the 032 Philippines, we currently experience, I think, ano tayo typhoon guys, no? I'm not sure. Or just the usual rain. I'm not sure. Signal number one. Okay, so may pa-update na. Signal number one na dito. Okay. So again, guys, good morning to those who just came in. For our topic for today, our last topic before we get to the midterm is your abdominal wall and cavity. Again, this is just a continuation by each of your regions of our body. So we got to finish this one first before we get to deal with the pelvic wall and cavity after this, and then right away we will start na your upper extremity and lower extremity for the finals nga topic. Okay, so enough with the chit chat. Okay, let's get into na guys with our topic. Okay, ladies and gentlemen, welcome to abdominal wall and cavity. Okay, so just to confirm guys, same ba guys? Duha pa gihapon ba ka chapter in your Tito Richard Snell or only one chapter under this one? Hello? Kinsa nag-open na diha og Tito Richard Snell? Please confirm. Mm-mm. Okay, check daw guys please. Same ba siya sa thoracic wall and cavity?
Yes, sir. Duha, sir.
Duha gihapon. Okay, so thank you. So same, di ba? Duha gihapon. But here, guys, in this topic right here, before we get to proceed for the specific information under this topic, is same thing with your kuan guys. With regards to our cases or conditions that we need to deal in the clinics, it is more kuan guys, it is more sign and symptoms that we need to consider here under this category. Okay, it's not purely bitaw sa inyong musculoskeletal like in your upper X and your lower extremity that you can just right away have the PT impression, or let's say it is more simplified in our practice because we if especially if you already have the foundation. Here guys, kani bitang thoracic wall o kaning abdominal wall and cavity, kuan siya guys, mas complicated siya. Again, I'm not sure if I already mentioned this in your block, but during in our practice, mas lisod bitaw siya guys, mas difficult siya i i-diagnose si patient. Okay? Because there are signs and symptoms, okay, compared with your lungs and heart, that it is more what they call this, it is the only two structures that you need to consider, like what is purely involved, like is it the heart or is it the lung itself, or both of it is or are affected. But here guys, in your abdominal wall and cavity, mas complicated because if you consider the structures inside it, di ba mas daghan og organs, especially your pancreas, spleen, liver, intestines, and all, kana siya. So there are um, similarities, okay, with regards to the signs and symptoms that we need to deal in our practice. But somehow, if we can, if you have, not everyone organs that are being tested as from from a therapist view or for a physical therapist view nga makuha na to ang diagnosis ni patient. No, there are only I think two or three organs that we can further confirm that it is purely involved. Majority of this one, guys, is considered sa kanang mga laboratory procedures nila. With the use of what, guys? Any idea? Unsa nga diagnostic procedures i-undergo, especially in this word, abdominal wall and cavity. Na ba tayo idea diha? Anyone? Unsa nga laboratory procedures? X-ray ba gihapon? Okay, your ultrasound. Very good. Ultrasound, guys. Okay, and somehow you need to support that as well based on the presented symptoms or signs, okay, that your patient is dealing this time sa ingon ana. Okay, but again, there are two types of ultrasound ha that you need to consider because in our practice, guys, naa sa tayo-own nga ultrasound. Aware mo ana, guys, na tayo-own nga ultrasound ang PT? Anyone? Wala. Okay, in our practice, guys, just for you to know, again, this time, the ultrasound that can be used in the procedural laboratory findings is purely for imaging. Okay, makita guys ba if normal ba, abnormal ba ang mga contour unsa na dira dapit sa sud sa organ ni patient. But in our practice, ang ultrasound nga atong gigamit or we widely use is purely for deep heating. Copy guys? Are you still there? Hello?
Copies.
How about the others? Are you still asleep, guys? Where is your larynx this time? No owners of this account. Hello? Patay, walay mga owners ang mga account. Guys?
Hello, sir.
Natog pa tabihan dapita. Okay. Asa naman yung uban? Uy, good morning.
Morning, sir.
Good morning, guys. Asa naman yung larynx na to ang uban? Murag tulo o patra ka akong students, Lord.
Morning, sir.
Okay, na-admit. Hello, good morning. No, so I hope you are following, guys. Para na namoy idea ba? Okay. Mao din na siya, sir. Mao din na among gamiton in the practice, sir. Okay, dili mag-image mo ha nga. Ingon man gud to sis inyo niya ako i-quote niya nga okay, according man gud ni Sir Joms that we can purely perform in our practice for ultrasound that is for imaging. No, okay, it is for deep heating, guys, in our practice ha, not for imaging. Lahi na ang imaging, guys, ang mo perform ana, dili na ang PT. Okay, so let's continue. Okay, so first, we need to discuss the abdomen itself. Yes, it is the region of the trunk which lies in the diaphragm above, in the inlet below. Okay, so purely the opening right below here sa atong abdominal area. So we have again, guys, the boundary. So superiorly, you have what? Anyone?
Diaphragm, sir.
Diaphragm, sir.
Very good. Your diaphragm.
Sir.
Okay. And then inferiorly, guys, as we mentioned, inlet. What inlet are we referring this time? If you're talking towards the... Okay, good. Very good. Okay, the pelvis here under sa inyong abdominal area. Okay, so anteriorly, you have the lower portion of the thoracic cage itself, and by the abdominal portion, if you can still remember katong mga floating ribs nato dihang dapitan, no? And then posteriorly again, you have the exact vertebrae. So what vertebrae are we referring this time, guys, in your abdominal area? Thoracic pa ba gyapon o cervical? Hello? Good morning.
Lumbar, sir.
Okay, very good. Your lumbar ha. Lumbar area na diha, guys. Kay base na niya mo answer. Sir, cervical na diha, sir, sa atong abdominal tay sa jud, guys. No, murag di jud ko ka picture out, guys. Maabot ang atong cervical or cervical bones or vertebrae here going towards our abdominal area. So murag so murag oo, guys, I cannot imagine your stomach and all na sa imong neck area. Do you get me, guys? Okay ra ba? Ang stomach na sa inyong neck area. Ang mga liver. Hello? So kana ha, so please do, okay, have the basic orientation and the location of the specified structures. Okay, to continue, laterally again, same thing, you have the 12 rib, upper part of your pelvis, the posterior wall muscles, kana bitaw, as you touch the area, kana sa inyong hawak, kana sa inyong hawak ba? O hawak kana sa above siya inyong buttocks kana siya nga portion. Okay, and then the lower portion of your thoracic wall, the lungs, and of course the pleurae of each of these lungs. Okay, so for the structures of the abdominal wall, these are the specified structures that we can um, um, that serve as our topic later on in this lecture for today. So anteriorly, of course, you have your skin, the superficial and the fascias, the muscle again, the extraperitoneal fascias, and the parietal peritoneum. So if you're talking about the what you call this, the thoracic wall and cavity, you have your mediastinum. Okay, but here if abdominal lagi nga portion, guys, if makakita na mo anak nga word, if you encountered the word peritoneum, okay, whatever is in the book or in the lecture and all, that's basically referring to your abdominal portion. Okay, kanang peritoneum. Then posteriorly, again, you have the lumbar and their intervertebral disc, the 12 rib and upper portion of the pelvis, and each muscles and aponeurosis. Aponeurosis, guys, mura ra siya og covering. Okay, so later ato na na-expound ng mga structures. So here in the regions of the abdomen, guys, we have the 4 quadrants. So basic ra, self-explanatory, right, left, right, lower, right and left, lower and upper quadrants. Guys, let me ask you this times, unsay ko ani guys, like what's the rationale behind these 4 quadrants? Like para unsa maning 4 quadrants, oy? Anyone? In your
Um,
understanding.
uh, One way that we could utilize these regions, sir, is that if there are injuries there, or like if we palpate the area, we can identify the possible structures or organs that might be affected or might have problems.
Okay. Yes, very good. How about you, Horn? Yes, Horn, you're raising your hand.
Um, oh, I was just gonna say the same thing. But I
Ah,
guess to piggyback, including the like arteries and the blood vessels that pass through that and like supply the
mm-mm.
organs are like a part of that. So
Okay.
there are like a lot of uh there are a lot of important blood vessels that are going to and from the heart.
Mm-mm.
Um, and yeah.
Okay. Thank you, Horn. Okay, got it, got it. Yes, possible. The blood supply, the circulation itself, no, we can also identify which is affected. Okay, so anyone to add with that? Like, unsa man para asa ni four quadrants oy? Ano na pa man ni four
Kwan,
quadrants?
sir. For me, it's like to divide the stomach, sir. Like, for example, sir, sa right upper, sir, kinaang liver, inanagi, sir.
Wait, naglibog ko Pasko sa imong gipasabot nganong i-divide ang stomach.
Ay, kanang murag ang part sa abdomen, sir, ba? Like, in our abdomen, daghan biyag murag, kwan, sir, like, organs, like, na ang spleen, na ang gallbladder, sir.
Ah, okay. You're referring the specific organs. Is that what you mean, Pasqua?
Yes, sir.
But not really i-divide imo ang stomach or i-divide ang stomach. Unsa man jud?
Dili siya
Pasqua.
sa organs ako pasabot, sir.
Ah, ang organs niya. Oh, so maglibog ko Pasqua no. So again, please um be specific of your answers. Okay? So again, it is not the division of the stomach itself, but the specific organs daw according to Pasqua. Very good, Pasqua. Yes, Fajardo.
I have an idea sa ang reason na di-divide sa four quadrants sa kay para mo daw anatomical landmark sir. For example sa surgery sir. So it will be easier to
Okay.
identify which is which.
Okay, very good. Yes, surgery, special surgery. Yes, Initan? Ah. Mm-mm. Mm. Very good, no? Yes, very good. No, na-apply na gid ang palpation. Very good. Okay, initan. Yes, Gavito. Hello, Gavito.
Ay, sir, kuha lang, sir, ka nang makuha naman, sir.
Ay, nakuha na di. Ay, sige, sige. Okay, so wala na mo add. Yes, Fajardo, you're still raising your hand. Or you forgot to unraise it. Ah, okay. Forgot to raise it. Okay, so going back, guys, no, to the topic. Yes, correct, guys. All of your answers this time, no? It is basically for the specific organs that we need to locate. What are these organs that are specifically located in each region? Okay, as what mentioned ni Inita, no? Based in our practice as a physical therapy, 'di ba? We need to palpate. Okay? So in order for us to examine these structures, we need to know where the exact location of the structure so that we can purely assess the okay, that is purely the problem ni patient. For example. Okay, that is good answers to all of you. So, thank you so much. Okay, very good. Let's continue. So, for the exact allocation, guys, of your four quadrants going back here, so what are those structures di ay guys nga atong makitaan in each of these quadrants? Let's start with your right upper quadrant. Anyone? What organ?
First, sir.
Sure, liver. Okay, very good. What else?
Gallbladder, sir.
Okay, your gallbladder. Okay. How about your right lower?
Reproductive organs, sir.
Reproductive organ? I don't think so.
Like
Reproductive
side of the
organ.
ovaries, sir, for example.
Ovaries, yes, possible if you're referring to the one laterality, no, of or one side of your ovary and all. What else, guys?
Appendix, sir.
Appendix.
There we have the appendix. Again, guys, ha, the specific structures, ha, that we can really have this here in the right lower. What else? Panaadi ha, uy.
Your kidney, sir.
Okay,
Oh,
very
a right
good. Ang
kidney.
right kidney. Okay, what else? Natin naka-mention ganing how, I think intestine, but dili lang siya specific. Naanay specific, guys. Paladaghan ng colon. Oo. Ang usa ka colon kay student diri nga batch, di ba? Oo. So daghan kay ang colon, guys. Asa man gyud ni siya, guys?
Upper portion, sir, ang gatalang.
Ha? Upper
Ay.
portion? Upper ba?
Hindi, sir.
Ascending. If you're pertaining to ascending, guys, it is more crossing naman good na sa both sa right and upper. So purely right na siya. Okay? Like which specific structures that we only locate this time, guys? The part of that intestine. Unsay name? Anyone? What good?
Try ko, sir.
Go.
Majority sa ileum, sir.
There.
Or-
Kana, guys. Very good. Okay? It's your ileum, ha? Okay, your ileum. How about the left upper? Go. Unsa man na diha?
Stomach.
Stomach. What else?
Pancreas, sir.
Spleen, sir.
Left lobe sa liver, sir.
Okay, pwede, no? Ang kuan sa inyohang liver, pwede sad. But purely, guys, ha, ay para dili ta maglibog, ha, inyohang liver, it is purely located, ha, sa right upper. Kaya base niya, naa niya question, not just here in our examination, but somehow later on in your local board examination, maas mo, asa ang liver, tingnan niyo yung answer niyo left. Or right and left. No, right, rajud na ang liver. Guys, do you copy? Ha?
Sir.
Okay, so how about, let's go to the left lower. So yes, we have the left kidney as well. What else?
Small intestine, sir.
Okay, small intestines, pwede. But again, guys, more on kung ano na yung small intestine. More mo guna siya nag-cover na jud here for the whole region, diba? Yung mga small intestine here in the mid portion of your abdomen. Unsa guys, naay specific nga structure diha nga ato i-locate sa left lower. What is that structure? Anyone?
Sigmoid colon, sir.
Pwede ang sigmoid. What else? It's your what, guys?
Descending colon, sir. Ay, the distal part of the descending colon.
More on ang descending, kung ano na siya, what do you call this? Same thing with your ascending colon, guys. It will cover up for the whole portion of that quadrant. Like, ang ascending right, upper, and lower. Ang descending kay left, lower, and upper. Do you get me? So, kana siya. Wala?
Okay, sir.
Mm-mm. Anyone? Anything to add? For left, lower nga structure? Specific? Sige mo, sa panadiha. It's your? Okay, wala na. Okay, so it's your diverticulum, guys. Sige lang, later ato na makita. Okay, now let's go to the 9 regions. Okay, so for the 9 regions, guys, number 1, it is your, take note that this is your right and left, kaning 1 in 3 nimo, that's your right and left hypochondriac. Okay, 4 and 6, this is right and left lumbar. Then 7 and 9, that is your right iliac and left iliac. For number 2, this is your epigastric. Number 5 is umbilical. And 9 is your hypogastric. Copy, guys? Hello? Napa mo diha, guys?
Yes, sir.
Yes, sir.
Okay, so let's proceed. So first, we need to discuss first the skin. So it is loosely attached to the underlying structures. It has a lines of cleavage that run down and forward. Okay, so tayo sa sir line. Sir, naay lines of cleavage. Marag wala naman yun yung line ang mong tiyan, sir. Okay, to those who still have lines, very good, no? You still have the lines over there, but same thing here, guys, no? In my portion of my abdomen, no? Same thing ta, guys. Dili na kayo makita diha ang mga lines in all. Okay, that runs downward and forward, no? More on lahi na ni nga lines. So more on pa horizontal na jud ni diring dapita. Okay, we have the same what they call this setup in your anterior abdominal wall. So what is this structure, guys? That is also known as a median band of interlacing fibers that under the cover of your skin and fascia. It is also formed by fusion of aponeurosis and muscles of your anterior abdominal wall, and it is also considered as a linear depression extending from your xiphoid process towards the symphysis pubis. What is this structure? Anyone?
The symphysis
Linya
pubis.
alba, sir.
Oh,
Again, I'm sorry, what was that?
so the
Okay.
I'll take it one at a time. Isa mo ito na yung answer una.
As
the
a whole, sir.
symphysis pubis, sir, but
Okay, let's, oh my God. Oh my God, we need to deal with this one. Okay, let's have Horn first. Go, Horn.
I'm sorry to.
Okay, it's okay, go.
So the symphysis pubis is basically like where the two pelvic bones meet in the middle,
Mm-mm,
like the median line. I believe you can feel it on yourself, like it's palpable.
Ah, yeah, okay. That's it, Horn. Hello.
Yes, sir.
Okay, good. Thank you, Horn. Okay, copy. How about you, Fardo? Ano sa team answer?
Ang structure man, sir, no? Ang kwan, sir, I think it's the linea alba, sir.
Okay, it's your linea alba. Okay, it's kana bitong kinsay kuan, guys. Who among you here mo work out or still have abs over there? You may raise your hand. Sir, napakoy abs. Okay, flex naman dyan. Humble brag. Nada abs si Horn. Why not? How about the others? Wala? Uy, impossible. Impossible jud wala tanan mag-short ta dihang dapita, guys. In if mag face to face pataron mo kuha jud kog usa ka student ako jud ipakita sa abdominal portion o limb as well. Okay, very good. Okay, guys,
workout na sir, walay abs.
ay walay abs, nag-workout lang. But to those na ay abs, kisay na ay abs. Here, walay na ay abs. Guys, naata tanan abs, guys. Dili lang ina ka prominent. Okay, nakakuan siya. Discreet lang siya. Okay, so same here in my end, no? Nitago lang siya. Okay? Shy type ang mga abs. So here, guys, if you consider the linea alba, later on na ako ipakita. Let's just finish this one first. So first is your umbilicus. Okay? it's your pusod, right? Here in your abdominal portion, it's depression along the linea alba, and it also serves as a site of attachment of your umbilical cord during your fetal years, no? Katong fetus pata diha or neonate. Okay, and also we have this structure, guys, linea semilunaris, which is also considered as a lateral edge of your rectus abdominis muscle, okay, that can be found and crosses the costal at the tip of your ninth costal cartilages. Mao ni siya nga picture, guys. Asa naman ni? Ano di naman siya mag-next? Okay na lang. Okay. Here, guys, kinsay na ay abs. So here, guys, this is for if your skin will be removed here in this part, we have this side here nga line. Kani siya. Guys, naa pa si Corsair? Please confirm.
Yes, sir.
Naara, sir. Okay, sige, salamat. So here, guys, this is your linea semilunaris here. Kani siya ba? Okay, kani siya dire. And then here. Kani siya nga mga side. Basta side gani, this is your rectus abdominis muscle man. Okay, kaning mga packs nimo. Oo. Okay, and then for in the middle, guys, from the line of cleavage here sa imuhang chest portion going down towards your umbilicus or your navel in layman's term, we have this thing called your linea semilunaris. Guys, do you copy? Let's zoom this one. Okay. So here, guys, kani siya, guys, nga portion for the entire abdominal portion aning patient, for example. Guys, please confirm, makita ra ang difference? Can you see the difference between your linea semilunaris and linea alba? Hello?
Yes, sir.
So here on the side, linea semilunaris, and then in the middle, your linea alba. For you to easily remember this structure, guys, you may also refer the artist, no? Kisa na siyang artist nga na alba ang family name. Hollywood one. Kisa ganda siya, guys. Anyone?
Jessica Alba, sir.
Oh yeah, that's it, no? Si Tita Jessica Alba. Okay, naa siya linea alba, which is also corresponds with her body this time, di ba? Naagihapon siya abs and all. Okay, so to continue, we have this fascia. So we have superficial and deep fascias. So for superficial, it consists of superficial fatty layer and deep membranous layer. So we have Camper's, Scarpa's, and Colles fascia. So Camper's, guys, is just purely a fatter layer. Okay, it's a continuous with the superficial fat over the rest of the body that is purely extremely thick. Okay, so fat siya, sir. So marag naa sa ko ana, sir. Oo, so same here, guys. Naa sa taan, no? Mas prominent ang Camper's fascia. Okay, then we also have your Scarpa's fascia, which is a membranous layer that is situated in the anterior abdominal wall that goes down to the pelvic. And then for the Colles, guys, it's just a continuation of your Scarpa's fascia. And then for the deep fascia, it is more considered as a thin layer of connected tissue that covers the muscle that lies immediately deep to the membranous layer of the superficial fascia. So murag hapog a covering with another covering, diba? So that is your deep fascia. So here in the next image, no, saan naman hindi naman mo next. Okay, so here, guys, in this image right here, this is the layers, okay, of the superficial fascias in your anterior abdominal wall. Please take note, guys, that these are itemized based on what structures that you need to identify. Diba? Kana siya number 1, that is your skin, ana, and all. Please do not be confused or don't make it to the point that you need to understand nga, okay, that is the number 10, so that is the most deep structures. Okay, for the deep structures, guys, or the second to the last deep structures, that would definitely be your rather for the deep structures, that's your parietal peritoneum, and then the second one is your second to the last is your extraperitoneal fat. Okay, just take note of that, guys. Hello, are you still following, guys? 4, 5 people, 6. Okay, so okay ha, so kada lang ayaw ilibog kay basta niya inyo niya okay ang last kay rectus abdominis. Okay, no. Okay, now let's proceed for the muscles. Okay, for the muscles of your anterior wall. Okay, sir, di man kami makafeel sa muscle, sir. Okay, purely fats na maginidiring dapitas, sir. Okay, but again, guys, there are muscles, no? Okay, so don't be discouraged this time. Nga puro fats ra na atong ma-feel dira. Same here in my end. But somehow, we have the exact muscles, okay, underlying for these fats here in your anterior abdominal wall. Okay, so we have the following. You have your three sheets of muscles that are aponeurotic in front, which basically are from your external oblique, your internal oblique, and your transversus abdominis. Okay, and then for the midline, of course, you have your rectus abdominis, katong deeper portion, which is covered by your rectus sheath, and at the same time, your small muscle, this time called your pyramidalis. Okay, so first, guys, let's go to your EO. Okay, not EO optical clinic, but your EO nga muscle, specifically your external oblique. So for the action, guys, basaha og tarong, makasabot ra bata dihang dapita for the action. It will laterally flex the trunk, rotate the trunk towards the opposite side, and abdominal viscera and abdominal straining. Okay, so you also have this thing here, your superficial inguinal ring, that also a defect in the aponeurosis where the spermatic cord passes. Okay, under here sa inyong external oblique. At the same time, your inguinal ligament. Guys, nasabtan na ang action, lateral flexion of trunk, rotate the trunks towards the opposite side. Hello.
Yes, sir.
Yes, sir.
Okay, so kisa matunag, yes sir. Okay, so how about this time, guys? I-perform daw, okay? Lateral flexes the trunk. Let's have your EO first. Go. Lateral flexion of the trunk and rotate the trunks towards the opposite side. So basically, we have two. Okay, so let's start with your left. Okay, let's have kisa man. Okay, Dyongzon. Hello, Dyongzon. Good morning. Hello, Dyongzon. And then there was silence. Silence from Dyongzon.
Hello, sir.
Hello, Dyongzon. Good morning. Dyongzon, can you please show us your camera and all and perform the specified action of your, let's say, left, mag-start na sa right. Right external oblique. Like, how will you do it based on the action given here in the slide? Like in this time around in your end. Nakita ra ang action or ang slide? Dyongzon?
Kunin ko sir, yung data ako sir baka inuwan mo gud sa mga sir.
Okay.
Tingay
Ngayon sa man, ma?
dili ang afraid sir na dili ko maka show sir ba.
Okay. So, noted yung son.
Naka-data ako sir.
Okay, no problem, Dyongson. Okay? So, how about a volunteer, guys? Anyone? Okay na naman nag-leave. Okay, sige, thank you for your time. Salamat sa lahat. At dito na lang nagtatapos ang kanyang pag-admit dito na lecture. Guys, any volunteer? How will you do it? Right, EO. Here's ako, sir. Try ko, sir. Go. Why not? Right, EO, guys. Anyone? Ay, wala gihapoy mag-volunteer. Okay, so let's call na lang. How about you, Domingo? Go, Domingo. How will you do it, Domingo? Right, EO. Go, Domingo.
Actually, sir, I'm not. I'm not sure, sir. I don't.
Okay, go. Try lang. That's why we have a class. Sige na guys, para mas orient mo, like how will you do it ba? Exactly the muscle. Like lateral flexion and then rotation towards the opposite.
I can try, sir, if no one wants.
Okay. Okay, we have Horn. Okay, thank you, Domingo. Go, Horn. How will you do it, Horn? Right, EO.
Okay, hang on, sir. Oh, sorry, sir. My alarm. Can you see me, sir?
Wait, guys, naano ba si Horn? It's not, she's still here in my...
Naana, sir.
Oh,
Nana, sir.
there. I can now see you, Horn. Hello. Go,
Hi.
Horn. Right EO, ha, everyone. Observe. Horn, right EO. Like, basically, it can what again?
Lateral flexion of the trunk, sir. So it just bloop.
So, right lateral flexion towards what? Like, opposite? Same side? Like, what are you referring this time, Horn, based on the lateral flexion nga action under your EO?
I'm trying to think, sir. Well, this is this
Mm-hmm. Okay, okay. And then, for the rotation,
I'm assuming it's like this, sir. Like if you were to like, for example, like when you're working out and you have a dumbbell, you just like Russian twists, if that's the universal name of the workout. There
okay,
you go.
oh, yeah. Okay, I got you. Okay, very good, Horn. Thank you. Okay, so that's it, guys. So basically, it is side, guys, ha. It can also perform for the flexion of your trunk. Okay, and at the same time, it can laterally flex on the same side and rotations towards the opposite side. Okay, so vice versa na sa inyong left EO. Thank you, Horn. Guys, nakapira to, guys? Or question? Naglibog mo? You're still confused. Like, sir, labad akong ulo, sir.
Sir, just to sorry.
Go.
Sir, just to clarify, when you say opposite flexion, was I doing it right? Because for right EO, I know I wasn't doing the opposite side.
For the rotation, Horn.
Oh, okay. So it's just
Okay, for the rotation.
Okay.
That's correct. Okay, that's purely correct imong gi-perform that you did there. That's
Okay,
correct. For the rotation, ha. For the flexion, it's both fibers. Hello, guys. Are you still there? Hello.
Yes, sir.
Asa naman yung ba nato dira? Oo. So please ha, kana la dihang dapita. Okay? So, yeah, that's your external oblique. For the internal oblique, this just the fibers that runs at the right angles to those of the external oblique, and serve as having this structure, your conjoint tendon, which is serve as the insertion. Okay, joined by similar fibers from the transversus abdominis under your IO or your internal oblique. Okay, so for the internal oblique, guys, it has the same action. Okay, but there is what do you call this? Except for the rotation. Okay? Sa inyong internal oblique. So, dili siya same sa rotation. It's a guys for a while. Okay. Just to check, guys, sa inyong Tito Richard, correct pa ba akong gipang mention ng mga action? Please, do not hesitate to call my attention. I think, sir, or something confusion in your part. Hello, guys? Correct pa ba? Or yun as what you understood based on the information. Okay, so kana lang ha. So yeah, that's it for the IO. Now let's go to the transversus abdominis. Okay, so yes, for the action, it compresses purely your abdomen as you what you call this, kanang bitaw mo, hiyak mo. Okay, that's your transversus abdominis is doing the movement. Okay, it has your same thing, guys, your structure, your conjoint tendon for the insertion, and then your fascia transversalis also have this one here under here, transversus abdominis, which is a fascia that lines it, and it serves as a continuous with the layer lining with your diaphragm and your iliacus. Iliacus is a muscle, guys. Okay, and it has or consists your deep inguinal ring as well. Okay, so maura na siya. Okay, so here, guys, dili kani siya clear na image right here, but if you notice for the external oblique, more on pa V siya, guys, more on pa what you call this, and going anterior Okay, downward and anterior ang iyahang fibers for the external oblique, and then the other way around imuhang internal oblique. Okay, so murag pa V, and then ang imuhang IO kay pa letter A. Do you get me, guys? Murag letter A ang IO, ang EO kay pa V. Hello? Guys? So makita naman na yan. Okay? So, how about this one, guys? Okay? Let's have a quick analysis this time. Everyone, eyes on your screen. Unsa nga muscle ang weak daw? Oy, patient presents with limitation in bringing his or her right elbow towards his or her left knee. So, mura ni gi-perform ganihan ni Horn. Diba? So just purely doing the Russian twist, kono. Like in the gym, like in the, if you're working out your body. Like if you're twisting around or rotating your trunk this time. Again, difficulty or there's a limitation bringing his right elbow towards the left knee. Okay, so basically, he's doing the crunching of his abs or abdominal workout, rather. Diba? So which muscles daw, guys, are weak? Anyone?
EO, sir.
EO. But guys, naanay laterality. Which EO? Ala,
Right EO, sir?
anong EO yan? Right EO ba? Sure na.
Yes, sir. Kay right
EO.
elbow man, sir.
Okay. EO lang ba?
Kwan, sir, napod ang IO, sir? Sakto ba?
IO to bring the elbow down to the knee, sir.
Diba? Unsa to yung action sa IO? Anyone? Same with, unsa ba to? Same with EO, mangguro to.
Line rotation.
Very good. So, involved sad si IO. So, this time, same ba nga laterality gipasabot gihapon for the IO? You answered right, EO, for this problem here, guys. Same ba for the IO? Right gihapon? Sure na?
Opposite, sir.
Sure na, opposite.
Yes, sir.
Opposite. So, basically, unsa may inyong answer, guys? Final answer, uy. And then, so both imo. Okay, noted. How about the others? Guys, unsa inyong final answer? PT analysis. La guys, mao ba ni ato ang kuan, guys, problem. Both right, Initan. Okay, Initan, nag-change of heart si Initan. Both right for right EO and IO. How about the others?
Let me try, sir. Right EO, sir, niya na mo play ang role o ang left IO, sir.
Unsa imo again? Pardon, right.
Right EO, sir, niya mo play ang role sa ang left IO, sir.
So right EO and left IO ang involved ani.
Yes, sir.
Okay, copy. How about the others? Wala na mo add, guys. Or do you
Same na ko ni Initan, sir.
Okay, same with Initan. So right, purely imuha at oitings. Okay, so guys, here in this problem, guys, again, di ba? Contralateral rotation. So, sabotable na kaayo siya. That's purely your right EO is involved with this problem right here. But somehow, guys, there are also another muscles that you need to consider this one. It's your IO. Okay, for the IO, since wala man siya rotation, so we purely, what you call this, consider the IO on the contralateral side ang involved. Okay, since there is limitation man, diba, of one side of each of the structures between your IO and EO. So, contralateral, kung mo reach ka sa imuhang right elbow towards your left knee, you have difficulty reaching that knee, or limitation rather, if you have limitation. So, ang involved ani guys na problem right here is your right EO and your left IO. Do you copy? Are we still good? Please raise your hands in each of these accounts this time. Naa pa ba ning mga owners? Ani nga mga account, Lord? Oo. This time around. Guys, you need to understand good ni guys kay murag bisag mo abot pa mo og mga state board guys, if you're planning to go abroad again, di gud ni mawala nga mga question guys. Even in your practice, magkalibog jud ni siya. Hala unsa gid nga problem no? Oo. Okay, so if you're not considering it this time, if you're not basically understood rather, okay, what is the case is all about or the problem is all about. Okay, so there. Okay, I can see it now, guys. Okay, you may now unraise your hands. Thank you. Okay, so any questions? Please be honest. Be honest po. Opo. Sir, naglibog ko, sir. Unsa daw, sir? Guys, anyone? Don't be shy. Guys, lisod ni siya. If di mo kasabot gidihan dapita, unsa ang gipasabot sa problem? Who's raising a hand? Katipunan. Yes, katipunan, go.
Kanang ask lang ko, sir, if ang purpose sa left IO, sir, kay more niyag i-stabilize ang core muscles, ay ang core in general, sir, or dili ka, sir? Like,
I mean, ang iyong pasabot katipunan kay ang both, right, fibers?
Left, sir, left.
Ang left. No, if so you're sticking again with the problem, 'di ba? Correct?
Yes,
Kani
sir.
siya nga problem. Okay. So katipunan, kani siya katipunan since naa may contralateral rotation that is purely working here in this problem, since limited si patient, so ang usa ka fiber ang problem. Copy katipunan?
Sir.
But basically katipunan, if you're considering the both structures or the both fibers, let's say both fibers of your EO and both fibers of your IO, purely for trunk flexion sila. Copy?
Sir, thank you, sir.
Okay, no problem. Kisa pa tong usa na pati usa ni Reyes. Please be honest guys, kay magkalibog jud ni siya if dili mo honest this time around.
I think sir, si Sumanpan to, sir.
Sumanpan? Okay, go Sumanpan.
Sir, pwede ibalik tong explanation as to unsa to na side kay naglibog ko ato kita.
Okay, ani siya ha, bisayon ako ha, for everyone, for you to understand, no? Let's say it in our dialect this time. Guys, maglisod si patient mo reach. Okay, so basically si patient guys nagperform siya og abdominal workout exercises for core strengthening this time. But when you observe your patient, let's say for example, you're in the clinic, no, as a PT. Hala, maglisod lagi si patient og reach. Like your instruction, sir, let's do Russian roulette this time. And what I want you to do, sir, is to try to reach your right elbow going to your left knee. Diba? Kung maghim og crunch ka, guys, crunch exercises or Russian, Russian is purely kuan man, diba? Trunk ka lang. Let's say both let's say kuan na lang. Kana na lang, both upper X and lower extremity is working this time. So if iya i-bend iyahang what you call this, iyahang hip, this going towards flexion, okay? So iya i-move to reach his right elbow, maglisod siya, sumurag hala na limitation ba? Okay, but ang somehow ang PCAS or the other way around, ang left side maka-reach raman. Okay, as you observe, because you're a very amazing physical therapist, no? Grabe kay kakakin observer when it comes to your practice, no? When it comes to your patient. Na observe gud nimo hala, di gud siya ka-reach sa iyahang right. So this time guys, we are basically referring to one side of each fibers of your anterior abdominal muscles from your EO and your IO. Basta makita na ganyan nimo guys, mo contralateral rotation or rotation towards the other side, basically that portion right there is the same muscle working, your right EO. Okay? And then for the other muscles guys, or the other muscles that is also purely working over there, okay, you have the contralateral side, your left IO. Copy guys, Manpan?
Yes, sir. Thank you.
Naglipog pa ba ang uban? Asa naman taan? Yes, Katipunan, go.
Kuan na sir kanang let's say sir kuan sir kanang let's say if si lateral ang problem sir ba nga right elbow or right knee, so nag-apoy role ang IO sir sa kaning IO nga muscle sa kaning nga problem sir or purely EO siya.
Okay, kung right EO siya, kung right tanan yung pasabot ipa-reach mo right elbow, sa tim giingon right elbow towards right knee.
Yes sir, more kanang knee raise bitaw kanang exercise I forgot.
Kuan, yeah, both na ni siya sa kaninga side.
So,
okay, both side, right IO and right EO. Why? Because they can perform unsa to basic function nila kung both muscles both muscle fibers, right and left, unsa type action?
Flexion sir.
Very good. Flexion, Katipunan. So purely right tanan. Copy?
Wala direct involvement ang sa left sir no. Like to confirm.
Wala ra. Both na ni siya gyud, right and left.
Okay. Sige sir. Thank you sir.
Both na siya kay flexion man na siya guys. Ha? So kana lang. Basta nanagay contralateral mo ay kanina lang para di mo maglibog basta mo contralateral na gani na guys. I-take note lang gyud nga EO na siya. Okay? Ang same side gyud na siya nga ang same side gyud na siya nga EO kung mo perform na gay rotation. Copy? Pwede na maglibog. Ya contralateral ang IO basta na i-rotation. Copy guys, are we still good? Hello. Hello po.
Yes, sir.
Okay, ha? So kana lang. So let's continue. So for rectus abdominis, it's just a wrong strap muscles that is separated by your linea alba, as I already mentioned this one. And it purely compresses your abdomen. It also performs trunk flexion. And it also serves as for muscle for expiration, ha, not inspiration. Okay, for the lateral margin, you have your linea similaris structure, and it's also has your tendinous intersections between your xiphoid process towards your umbilicus, and considers halfway between the two. Okay, then again, it is covered by your rectus sheath. Okay, so here guys, and then we also have pyramidalis, okay, which the action is purely tenses the linea alba. Okay, pyramidalis guys kani siya mo siya gamay ra ni siya nga portion or pakapin ra ni siya nga portion nga muscle here. Okay, in your abdominal area. Not everyone has this. Your pyramidalis. So it's taken by its name, no? It looks like a pyramid nga muscle structure over there. Okay, so for the rectus sheath, this is just aponeurosis, so the covering of your IO and EO and your transversus, and encloses everything from your rectus abdominis and your pyramidalis, which also contains certain vessels and vessels. Then for the arteries, you have superior epigastric artery. Okay, for the arteries, kamo na lang ani guys based on the what you call this location. Then inferior epigastric arteries. Okay, where is it supplying? So dear guys, in this image right here, we can excuse me, we can only see the superior epigastric artery right here. Okay, and then here we have your inferior epigastric artery. So basically it is more on the posterior portion. And then we have also your deep circumflex artery, iliac artery, and lower two posterior intercostal arteries. I think I already mentioned your posterior intercostal arteries. Okay, so same thing guys, if the structures are there, it is for the lumbar area. So basically you have the lumbar arteries this time. Okay, so kanala na guys. Mura-mura ra gyud na ilang mga names diya kung asa sila dapita. Same thing with the veins, because if there's our arteries, it accompanies again with your veins. Then you also have lymph drainages, which is contains your superficial and deep lymph drainages. So for the superficial, you have your anterior thoracic axillary node and your superficial inguinal node. Guys, kung maka-encounter mo og word nga inguinal ba, unsay pasabot ana in our dialect? Uy. Inguinal.
Sa may bugan, sir?
Okay, very good. It's your bugan. Ha, it's your bugan. So make sure guys, it's not black pink na no inyong bugan this time around, no? So when was the last time you clean your bugan, Lord, no? Is it still pink? Or it has already na discoloration? Ha, so it's purely bugan na nga portion, guys. If you encounter ha, inguinal nga mga words, regardless if it's an artery or what else. So, kita na mo ana, it's purely naana na dihang dapita sa inyong bugan. Okay? And then for the lymph drainages here under your deep one, guys, you have your internal thoracic node, external iliac node, and your posterior mediastinal node and para aortic node. Okay, so you also have your inguinal canal, which the oblique, okay, passage, the oblique muscle passage to the lower portion of your anterior abdominal wall. As I've mentioned, diba, katong dahil dapit sa may mga inguinal ring dito nga portion. So it allows the structure to pass to in from the testes to the abdomen in males and permits passage of the round ligament of the uterus, this time from the labia majora of the uterus among females. Okay, this also transmits the ilioinguinal nerve for both sexes and lies above and parallel to the inguinal ligament. So for the openings, guys, you have your deep and superficial inguinal ring. Okay, for the deep inguinal ring, this is just a half an inch above the inguinal ligament, and it has its own oval opening in the fascia transversalis. Okay, and then for the superficial one, this is a triangular in the aponeurosis of your external oblique muscle, which is attached to the lateral portion of your ascis. Ascis, guys, if you kana bitawng say pangana na sa what is that term again in layman's term? Okay, familiar man, guys, no, kana bitawng V shape sa inguinal portion, like if you can see it sa bilba ka ng mga Victoria's Secret model, or if you have abs over there, guys, hello, are you still with me? Hello? Kanang pa V ba? Mga portion here in the inguinal area. Like, can you, do you, naka-observe ba mo, guys, na imurag bony prominent diha nga portion, like anteriorly na bony prominent diha? Like from the start of the V portion, going to the reproductive organ or the genitalia itself.
Yes, sir.
Ay, bony prominent. Ay, mura siya. Sa term, ano? Kalimut ko sa term, ano. Basta, ay, bony prominent diha, guys, at your portion sa inyong lower portion of your abdomen. That's your ascis, ha, or your anterior superior iliac spine. Sige lang, later in our pelvic na nga mga mag-laboratory ato na i-discuss. Okay? And then it's there's a curves downward medially to attach to the pubic tubercle this time, and also it is called your crura. Okay, kana siya, guys, for the males. Okay, you have your deep and superficial inguinal ring this time. Okay, so di ba mura na siya pakuan, guys, mura na siya appeal na siya, so it is accompanies with your EO nga muscles, ang deep inguinal ring. Okay, and then for the females, okay, you have your superficial inguinal ring over there. Okay, now let's go to the posterior abdominal wall this time. So posteriorly, again, you have 5 lumbar vertebrae and IV disc, and your 12th rib. Okay, you also have your pelvic bone. So for the specific structure of your pelvic bone that we need to consider here is your ilium. Okay, and then for the muscles, you have the following. You have your psoas muscle, your quadratus lumborum, your transversus abdominis, and your iliacus. So for the psoas major, this is a transverse originated at the transverse process, okay, and at the sides of your vertebral bodies in each of your IVD of T12 to L5. Okay, so for the insertion, excuse me, so for the insertion, this is inserted at the lesser trochanter of the femur, okay, and covered by a sheet from your lumbar fascia, which is taken to form the medial arcuate ligament. Excuse me, guys. And then for the action, it is purely for hip flexion and trunk flexion. So please, guys, consider the difference between them, guys. When can you say it is hip flexion and trunk flexion? So any one of you here na sa bedroom, like na sa bed, na ay bed? Hello?
Yes, sir.
Okay. Kisa may na-address sa bedroom this time. Hello?
Me, sir.
Okay. Same thing, rabata si horn. Okay, horn perform ko ano, let's have another way na pod guys, another student na pod. Okay, how about you over there? Bordario, good morning. Are you in your bedroom this time, Bordario? Hello. Let's do this, guys. The action. Let's have the basic action first. Hello, Bordario. Good morning. Hello. Wala na di ay dili na gid si Bordario. Bahala ka da, sir. I will not. I cannot. Okay. So how about you over there, Felicio? Hello, Felicio. Felicio, good morning. Uy, guys. Asa naman? Go, Felicio. Are you in your bedroom, right? Or no?
Ako sa sala, sir.
Okay. So let's have kuan lang Felicio, okay lang na sa sala. Okay, let's have first Felicio your hip flexion. Like how will you do it, Felicio, your hip flexion? Show it to your camera this time. And then this one, sir. Go, Felicio. Hip flexion. Para na natay koan, guys. Like an entry. Yeah, an entry to your lower extremity. Kana lang sa, let's have that lang sa nga action. Hello, Felicio. Are you still there? Go, Felicio. Uy, Felicio. Uy, Felicio, are you still there? Hello.
Sir, I think na ko siya prepare, sir. Wait lang. I think, yeah.
Okay, sige. Okay, noted. Okay. Wala mong good tingog na si Felicio, Lord. Oo, ginaunsa na si Felicio. Basic action lang sa ta, guys. Di lang sa ta mo go into the details with your regards to the extremity itself. Like, let's take note lang. Like, what is that specified action based on your psoas nature this time?
So bringing it back down. Flexion, extension. Now, anatomically speaking, if you're in an anatomical position,
Hello, sir. Morning,
Go,
sir.
Felicia!
Unsa gito ako, sir?
I-perform daw, Felicio. How will you do it, Felicio? Your hip flexion. Hello, good morning. There, we can see you now, Felicio. Hello. Okay, go, Felicio. Sa una, hip flexion.
Di ba ko sure, sir, pero
Sige lang, go.
Erase imong leg, sir. Sakto ba, sir?
Erase ang leg. Like, where is it going, Felicio? Ay, Felicio, mawawa ka.
Sa front, sir. Tapos magiana.
Ay, wait. Okay, sorry. Felicio, let's have laterality lang sa ha. Let's have right. Right. Sorry.
Right.
Right hip flexion.
So, padung ka here, sir.
Everyone, tanawa si Felicio, guys. Padong what, Felicio?
Padung sa right, sir. Like yung right leg, padung sa right. Then, mulin ka. Sakto ba, sir?
Hip flexion, ha? Wala? Like, no idea?
No idea, sir.
Okay. How about trunk flexion, Felicia? Sige lang, I will instruct you later after this one. Then, observe lang, guys. Trunk flexion. Ato man nag-discuss sa inyong back and spine. Like, how will you do it? Your trunk flexion, Felicia, go.
Ano ba to, sir?
Trunk flexion. Nalimtan na. Guys, naka-back spine mo.
Ay, gato
So,
anak. Pabako,
so
sir.
mong good guys. Ha? Okay, go Felicia. Sige lang. Okay ra na. Go.
Yung bowing, sir. Pabako.
There. Kana. Okay, that's your trunk flexion, ha? Very good. Ang katong una ni mong gibuhat, unsa man to Felicio? That's what?
Tension to, sir.
Yes, very good. That's your extension. If you're leaning back, like lean back, that's your extension. If forward, reach forward jud ka, that's your flexion. For hip flexion, perform Felicio ha as I instruct you. Okay? Up, for your right, go Felicio ha. Okay, try to lift. Okay, lift your knee towards your chest. There. Kana siya. Ha? Copy everyone? Hello. Wala tayo sa murag ang balance. May problem si Felicio sa balance. Felicio, makabalance ra. One leg, go. Kaya? Okay, go. Why not? Okay, go. Kaya ra di ang balance. No? Makuyawan na ta if wala na yung balance. Okay. How about your left side? Can you do it?
Yes, sir.
Okay, there. Okay. Guys, na-observe na ninyo sa Felicio. Hello, guys. Please raise your hands or hearts or likes in each of these accounts here. Are we still good? Okay, thank you, Felicio. Thank you so much. Okay, there. In ato ha. So, mo to'y hip flexion, guys. Please take note lang. Tanawa si Felicio, guys. Pag hip flexion niya, guys, murag ni grasp pa siya sa ilahang chair and all, no? To gather balance, Lord, no? Kaya murag lisod yun niya, no? Kung one extremity lang. Okay, so please consider that as well. Okay, as you get to your treatment later on, no? What are those you did observe from your patient? Aside from both lateralities, like tupong bagid sila, same bagid sila og action ang imuhang psoas major for the action of hip flexion or your iliopsoas in general. Copy, people? Hello, Black A. So kato lang ha. Okay. So kana lang guys. Di lang sa ta mo go through sa uban action. Later na ta mo go through sa ubang action sa inyong lower extremity. But this time at least na namoy usa. Okay? Nga inyong nahibawan. Okay, for the psoas minor, so it has two fibers. It's either psoas minor and psoas major. So for the psoas minor, it has purely just a small muscle that lies anterior to your psoas major. Okay? So, bali siya guys sa imuhang pectoralis. Okay? Sa inyong upper axis. I think naka-mention ko pecs, di ba? Sa yung thoracic wall cavity, correct? Please confirm. Naka-mention ba ko? Pectoralis major and minor. Oo. So, bali siya guys ha sa inyong pectoralis minor and major. Okay, thank you. So, bali siya. So, this time, di ba, as I mentioned, ang pectoralis minor, ibabaw inyong major followed by your minor, which is the deepest one. But here guys, in your lumbar area, your psoas minor is more anterior na this time. Okay? Of your psoas major. Okay? And it also is considered as an unimportant and often absent. Okay? It's not purely nga naaragid na si psoas minor diyan dapita guys. So there are two na. So unsa man tong usa ka muscle guys? Again nga, na often absent sad. What was that?
Pyramidis?
Okay, your pyramidalis. Ha? So anteriorly, what is your pyramidalis that are often absent? And for the posterior portion, you have your psoas minor. Okay, and then here guys, we also have your quadratus lumborum, which is considered flat and quadrilaterally shaped muscle. For its origin, it is originated at the iliolumbar ligament, your iliac crest, kana bitong bone diha nga area nga inyong sa inyong waist, di ba? Sa inyong waist this time, di ba? If you can feel that bony prominences over there, that's your iliac crest. Okay, then the transverse process of your lower lumbar vertebra, and then the insertion is at the 12th rib and the transverse process of your upper 4 lumbar vertebra, which is covered by the following fascia, which is your lumbar fascia, and also taken from your lateral arcuate ligament. The nerve supply is from your lumbar plexus. Okay, and then action is purely depresses the 12th rib and also lateral flexion to the same side. Okay, that's your quadratus lumborum. So iliacus is just a fan shape. Okay, at upper portion of your iliac fossa is located. Okay, and then it's joined for the insertion, it joins the psoas major to insert in the lesser trochanter of the femur. Then for the nerve supply, it is from your nerve, femoral nerve, and then again guys, for the action, it is for hip flexion or your trunk flexion. Do not be confused, guys, because somehow in your book, I think it is, yeah, it is purely designated in each muscle fibers, no? But in general, guys, in general or in our practice, we will consider it as an iliopsoas, like the combination na ba of the two. Copy? Kaya basi niya, iliopsoas, iliacus siya gina. Okay, so it consists again two muscle fibers between your iliacus and your psoas major. Copy, guys? Kani siya ba?
Copy, sir.
Okay. So, kana. It's the end of this slide. We are done. No, we're not yet done, guys. Again, this is just purely your wall. So, dito na ta sa, let's continue to your abdominal cavity this time. Now, let's go to the organs this time, guys. Okay, so please confirm, guys, if naa na si slide. I'm now sharing it na. Tell me if sir naa na, sir.
Not yet.
Okay, let's just wait for it to pop up. Saan naman eh?
Ano, sir?
Naana? Okay. So, okay, everyone, let's go to your abdominal cavity this time. Okay? So, for abdominal cavity, you have your peritoneum. As I mentioned, diba, if you have mediastinum, your thoracic wall and cavity, here in abdominal area, you have your peritoneum. So you have your extraperitoneal tissue, which is considered as a connective tissue between your parietal and fascial lining of the abdominal and pelvic wall. Okay, same thing, guys, na siya peritoneal cavity, which is a space between the parietal and visceral layer. So same thing ra di ay, sir, sa inyong heart o lungs na parietal o visceral layer. Yes, okay, a covering with another covering. And for the deeper structure, you have your visceral. Okay, so here, guys, under here, you have your greater and lesser sac as well. Okay, later ato ipakita ang image. Okay, then to continue, okay, your peritoneum is a serous membrane lining the walls of your abdominal and pelvic cavity. It's a clothing structure, okay, more siya clothing structure towards your abdominal and pelvic viscera, which again, it consists of two layers between your parietal and visceral. Kani siya, guys. Okay, kani siyang pink portion. Okay, mo ni siya ang peritoneum. Okay, and then we also have your epiploic foramen, which is a structure between your greater and lesser sac, which is considered as an oval window and serve as communication between the two greater and lesser sacs. Okay, and you also have your interperitoneal organ, which is almost totally covered with your visceral peritoneum. So a good example is, what are these, what they call these structures, guys? Anyone? Uy, everyone, hello, good morning.
Good morning,
Stomach.
sir.
Okay, very good. What else, guys? Intraperitoneal organs.
Spleen,
sir.
Spleen. So we have two now. What else?
Ileum.
Ileum. Then, what else? Ano na?
Jejunum,
Yun
sir.
lang ba lahat? Okay, very good. Your jejunum. So again, you have your stomach, your jejunum, ileum, and your spleen. Okay, as an example for your intraperitoneal organs. While your peritoneal organs, okay, partially running, okay, covered by your visceral peritoneum. So you have your pancreas, ascending and descending colon. Okay, for the examples for your retroperitoneal, guys. Again, pancreas, ascending and descending colon. So, kari siya, guys. Muna sila. Okay, peritoneal membrane and all. So, for the specialized areas of peritoneum, so you have your peritoneal ligaments, which is two layered folds that connects your solid viscera towards your abdominal walls. Okay, it also consists your falciform ligament. Okay, which is a ligament that connects the liver to your diaphragm. So, unsa na siya? Connect the liver towards your diaphragm. Unsa nga ligament? That's your falciform ligament. So, for the ommenta, these are two-layered fold, the peritoneum, that connects your stomach to another viscera. So, it's either you have here your greater and lesser omentum. Okay? Mo ni siya, guys. Okay, so greater. So obvious naman guro guys, no? Asa si greater? Yellow or blue arrow? Greater. Momentum. Hello. Hello, hello. Hello guys, are you still there? Obvious ra ba? Okay. Obvious ra ba here in this image right here, the greater and lesser momentum?
Ang blow mo.
Ang low? Ang lesser? Unsa ma? Ha? Unsa? Sure na.
Blue, sir.
Blue, sir. Ang lesser.
Ala, asa mong gitad guys, mag-sure taga.
Blue, sir. Kay lesser niya. Yellow is greater.
Sure na jud.
Yes, sir.
or the vice versa na jud ni dirang pit. Okay. Yes, correct guys ha. It's your yellow ha, ang greater. Okay, blue ang less. So kani siya the actual pero di lang kani siya makita. Oh no, not makita but somehow what's the right word? Visible like really mo siya blurry nga image. But that's the actual greater and lesser omentum or omentas. Okay, so for the specialized areas of peritoneum, you also have this thing called your mesenteries. Okay, these are two-layered folds of peritoneum which connects the parts of your intestine to the posterior abdominal wall. Everyone, eyes on your screen. This is purely for our lunch later. Possible, no? Mag-lunch na ta, no? So, disclaimer guys, murag makita gid nato ni guys ang mga sold sa atong tiyan and all. Okay, so I welcome you this image guys. Unsa inyong makita nga food guys? Familiar guys, no? Unsa din nga food?
Chicharong bulaklak, sir.
Mao pa na siya kanang sa pungko-pungko, no?
Isaw, sir.
Yes, sir. Ginab.
O kana, mao na no.
Chicharong bulaklak, sir. Parehas.
Wait. Chicharong bulaklak ang ginabot sa okay, sige. Kasi okay, basta mura siya ani guys. I think, wait, crispy ba ni siya? I don't eat mango ngayon, ana. Nga mga...
Crispy na, sir.
Naiuban, sir, nga murag guma taon, sir.
Wait, kaning murag web mo'y crispy or this one guys, ang intestine itself? Ma-crispy ba, sad or no?
Ang intestine mo'y crispy, sir.
Ang intestine. Pero ang web?
Panagsa.
Ang gummy siya, sir.
Chewy ang
mao
web
ba?
sa part.
Mura siya guma bitaw, sir. Murag dili siya nimo matulon.
I thought ang web mo'y crispy. Oh my God, it's the other way around akong understanding. As what I understood this one, guys. Okay sa food. Okay, so okay, I copy that, no? Mas crispy di ay ang intestine kaysa sa kaniyang web. So kanisya guys, kaniyang web structures here, these are your what you call your mesenteries. Copy? Mo siya guys. Mga mesenteries. Oh my God. So later, mukaon na mo pungko and all if you know that word, okay, here in Cebu. Okay, if you what you call this? Have the what you call this to try. Okay, let's say matawag bang exotic food ni guys? Exotic, right? Do we consider this an exotic food? Correct? Diba? Like, pwede ba?
Marag delicacy, sir.
Delicacy. Okay. So, yeah. You may try this, guys, in what we call pongko, where they will serve this one, guys. If I don't know of who among you here familiar with in Lapu-Lapu? What you call this? Known nga pongko. No? Like, oh my God, guys. They will serve you guys bigger, what you call this? Kung sa tawag ani? Sa tawag ani? Ginabot, no?
Ginabot, sir.
Oh, like, oh my God, guys. It's like a dinosaur jord. Like, oh my God. Like you're thinking twice, like, oh my God, is it really from the what you call this, pork or human na yun siya nga mesentery. So yung you'll be thinking twice. Murag human na yun siya nga mesentery. Okay, they will serve you guys larger ginabot this time. So yeah. That's good to know. So that's your mesenteries. So let's go now to your organs. So again, for the GI tract itself, you have your esophagus, diba? Continuation naman dito siya from your what do you call this? From your thoracic wall and all. From your head and neck itself, diba? For the entry point of your esophagus, diba? You're from your pharynx. So it's a muscular collapsible tube that joins the pharynx to the stomach, which a greater part lies within the thorax. And also it pierces the diaphragm and enters the stomach on the right side, okay, and conduct food from the pharynx towards your stomach, di ba? As you intake, for example, di ba? The ginabol. Okay, so it consists with wave-like contractions of the smooth muscles called what? What is that? Okay, very good. Your peristalsis. Okay, kana siya, guys. So here we have your gastroesophageal sphincter. Ano ni blurry naman siya? So kani siya here. So it's not an anatomic sphincter itself, but it is just purely considered as a smooth muscle that serves as a physiologic sphincter. So its relaxation allows the food to enter the stomach, and contractions for prevention of regurgitation or regurgitation. Okay, either way. Okay, now let's go to the stomach itself. Okay, so it's a dilated portion of the alimentary canal, which of course, as we all know, it's a storage for food and mixes food with gastric juices to form called your chyme. It controls the amount of chyme for digestion and situated in the left upper portion of your abdomen. So purely, guys, it is letter J in shape. So for the parts, please take note na lang aning mga parts, guys. Either way, you will have this man later on in your worksheet. Okay, sa abdominal portion. Okay, for the arteries as well, please take note na lang ano din the pita, where is it exactly located. So yeah, if you encounter na gani mga gastric arteries, gastroepiploic arteries, and veins, that is purely served in your stomach area. Kana sila. Okay, so kani siya, guys. Kani bitaw pink, guys, sa inyong N. Like kaning splenic artery. Pink? Same?
Pink,
Sure?
sir. Yes, sir.
Okay, pink. So, kani siya mga pink, guys. Please take note that is purely on the posterior portion nga makita in this image right here. So, purely this is an anterior structure of your stomach. Copy? Same, I think, in your netter. Oo, sa kanala. Okay, same thing with your veins and nerve supply. So let's now go to your small intestine this time. So it is considered as the longest portion of the alimentary canal that extends from your pylorus to the ileocecal junction. Pylorus, guys, kanibit ang last portion sa inyong stomach. Mo na siya, pylorus na siya nga portion. Okay, so dito na siya if going if you're not going the what you call it, the continuation of this one will be definitely your small intestine. Okay, so it's a greater part of your digestion and food absorption and consists of 3 parts. So it's from your duodenum, jejunum, and your ileum. Duodenum, jejunum, and your ileum. Okay, so kana siya, the 3 parts. Here, so this is your duodenum. So from your stomach area, then continuation, guys, that's your jejunum itself going to the anterior, and the last portion kanisha, that's your ileum. Okay, so for duodenum, it's C-shaped tube that joins the stomach to the jejunum and curves around the head of the pancreas. It is situated in the epigastric and umbilical region. If you remember pa mo sa katong regions. Okay, so for the parts of duodenum, it's just consists of your first to fourth parts. Okay, take note na lang of the specific parts in the picture later. Just take note that your first part begins at your pylorus from your stomach and runs upward and backward towards the right side of your L1 vertebra. So level na ni siya sa imong L1 vertebra, imong duodenum in general. Okay, kay ang first part na naman sa imong L1 vertebra. While your second one, this runs vertically downward in front of your hilum of the right kidney. Okay, and then third portion, this runs horizontally towards the left portion. And then for the fourth one, this runs upward and to the left to the duodenojejunal flexure. So mo na siya, guys, ang duodenum. Mura siya gi-divide lang siya into 4 parts. So yeah, this one for the blood supply, same thing guys, you have your superior and inferior pancreatico duodenal arteries. And same thing with the veins. Okay, so there. Anterior and posterior inferior pancreatico duodenal arteries. So for the jejunum and ileum, this consists of 20 feet long, which is at the upper portion you have your 2/5 portion, you have your jejunum, in the lower portion you have your ileum. So jejunum begins at the asa nga flexure guys. Hello, anyone? Which it begins guys, your jejunum, it begins where? Okay, so grabe dyan kayo ang separation no sa mga words, duodenal jejunal flexure. Okay, so yes, very good. Okay, you can say it duodenal jejunal. Right. Can you say it straight? Perfect. Word. Go again. Okay, why not, no? Copy that. Okay, that's good. Duodenal jejunal. Okay, so ayo kay duwa din no. So again, basin maas niya no sa practical patay 10 seconds ra ba ya no. Do na no, sige pa og repeat pa do na patay wala na jud no. Oo, nahurot na gyud ang 10 seconds at naduwo pag gyud gihapon ang answer. So yeah. So kana lang diha dapat. Then for the ileum guys, this ends at the ileocecal junction. Okay, so kana siya diha dapat. Blood supply, same thing guys, please take note na lang of this one, but this portion guys, you have your ileocolic artery. Okay, I think I already mentioned the superior mesenteric, okay, arteries and veins. Now let's go for the large intestines. This extends from the ileum to the anus. So for the parts, you have purely your cecum, appendix, ascending colon, transverse colon, descending colon, and your sigmoid colon. So you have also consists your rectum and anal canal and in the pelvic region, di ba? Pelvic region na gina guys imong anus diha or asa na mo mogawas atong atong mga feces, no? So that's your rectum and your anal canal. And then for the function guys, for the large intestine, again it's for the absorption of water and electrolytes and storage for the undigested material until it can be expelled from your body to as a feces. I already mentioned this one. So here guys, your large intestine. Okay, so your cecum here, your appendix here. So yeah, that portion right there. So for the cecum, this lies below the level of the junction of your ileum. Ano siya guys ang ileum? Okay. Parts of your small intestine. Okay, the ileum enters the large intestine at the junction of your cecum with the ascending colon where there is an opening provided with two folds which forms your ileocecal valve. Guys, makita ra guys, mura siya o mura siya opening, something like opening here. Kani bitaw? Akara in your end. Ileocecal valve. Hello?
Yes, sir.
So, kana siya. Okay, that's your ileocecal valve over there. For ileocecal valves, it's just an horizontal folds of mucous membranes that project around the orifice of your ileum. It plays little or no part in preventing the reflux. Okay, so another image right here. So for the blood supply, so same thing guys, applies with its names. If it's kita nagayabog cecal, okay, that's purely for the cecum portion, your anterior and posterior cecal arteries and veins. Take note na lang where is it draining, where is it came from, and for its function. Of course, for its function, it's just taking by its name. So same ragit silag pangan. Then for the appendix, it's a narrow muscular tube containing the large amount of lymphoid tissues which attach to the posterior medial surface of the cecum below to the ileocecal junction. This is purely located in the McBurney's point. Okay, asa man ang McBurney's point, we will get back to the region of the kuan guys, of the what you call this, of the image right there in your anterior abdominal wall. Please confirm guys if naa na si anterior abdominal wall. Ay. Bakit nawala? Naana guys?
We only see the appendix.
Ano ba yan? Ba't wala pa? So guys, please bear with me. What happened? Okay. Nana? I hope and pray, Lord.
Yes, sir. I know.
Reach of the abdomen.
Okay. Okay. Now let's go back again, guys, how what I meant about McBurney's point. Okay, McBurney's point. Again, ladies and gentlemen, let's now locate the McBurney's point. Okay, it is purely located, guys, here. Okay, if you want to locate by your own appendix this time, di ba? Okay, so here, guys, the landmarks are this one. Your umbilicus, and then your ascis. Guys, makafeel mo ana sa inyong bugan. Guys, hello, napamoy bugan? Can you still feel your bugan? Hello? Anyone? Hello?
Ano sa i-feel, sir?
Like, where is your bugan? Guys, feel your bugan this time. Ka-feel mo og bony prominent over there. Uy. Touch your bugan this time. Do it professionally. In your own body, Lord. I hope. Guys, are you touching now your bugan?
Asa na kita sa bukan ni touch, sir?
Bugan itself, kana bitawng lower portion sa inyong abdomen. Kani siya. Naapa si cursor, guys. Hello. Can you see the cursor? Uy. Guys, asa naman yung larynx, guys?
Sir, yes, sir.
Naapa si cursor.
Yes, sir.
Yes, sir.
Oh, feel this portion in your buga. Di ba buga na ni nga portion? Correct? Uy, inginal.
Yes.
Inginal. Oo, inginal. Okay, feel this portion. Naka-feel og bony prominent there, wala? Again, firm palpation. Don't touch it, guys, for the sake of doing the palpation. Purely do it firmly. Firmly. Iduso inyong fingers this time sa inyong bugan. Can you feel it? Uy, anyone?
Dili kayo, sir.
Dili kaayo? Na ay bony prominent here. Na ana dayes.
Yes. Ay, nana, sir. Na,
Even ako,
Kapil, sir.
chubby
Nana,
mo
sir.
ko.
Kapil, sir.
Even prominent kay ako ang anterior abdominal wall because I have this adipose tissue, no? Here in my end. I can still feel my asses. Here, kani siya nga portion, guys. So there, guys, if kana inyo na-palpate na ha, take note. If you did already palpate the structure here, your asses in your bugan area or your inguinal area, so you need to draw a line from here going to your umbilicus. Okay? Line here towards your umbilicus. So pa diagonal. So at the center of that portion, guys, so kung line, no, ana, kung center na gani na ninyo, like inyo i-point inyong ascis, anterior superior iliac spine in your umbilicus, okay, and then you locate the middle portion, kani siya, kung cursor nga mawa akong cursor, kana siya, this is where exactly located of your appendix. Copy? So this is what you call your McBurney's point. Copy, everyone. Hello, are you still following?
Oh, sir. Just to clarify, it's from that the portion of the right lower quadrant to the belly button, correct, sir?
Yes, specifically your right ascis. So locate first your right ascis here in your inguinal portion or your groin area. Okay, in your groin area, you will kind palpate. There's a bony prominent over there. That's your ascis. Okay, deep lang ta. Firm palpation lang i-perform, please, para maka-feel jud ka sa if you really want to appreciate, okay, the body structure, your ascis. And then make a line again towards your umbilicus. Okay, so paanad. Okay, the diagonal line, and then at the center of it, here in this portion, so this is the center. This is purely the exact location of your appendix, which is also known as your McBurney's point. Copy?
Okay. Copy, sir. Thank you.
Mm-mm. Guys, walay question? Nagets ra? Hello? It's me
No
again.
questions.
Good morning. How about the others? Guys, are we still good? Petra ang bugan, Lord. Naaray assist, everyone. So, ang uban walay, okay, so na nag-thumbs up. So, siya rin ay assist. So, ang uban wala tay assist, guys? Or wala tay nakapalpate sa assist? Okay, sige lang. Okay, so later in our lab, we will palpate yun, guys. Yes. No, halo sir, makita ito. Yes, tanan, guys. Di gini pwede, guys, na di na nato mapalpate. Palpate, gina nato tanan, guys. No, sige lang. Laboratory tanaw nato. Oo. Ato na i-double check. If na-palpate bagid or na-budget mo og assist. Sige lang. Okay, so going back to the, what do you call this? The area or the other organs. So, yeah. Please confirm, guys, if naa balik si katunga slide, previous slide. Ito na yung McBurney's point. Na. Hello, guys. Is it there already? Hello?
Yeah.
Okay. So, yeah. Now, okay. So, now let's go to the ascending colon. Okay. This lies at what quadrant? Okay, right. Quadrant. Okay, so your lower quadrant. Then, it also extends at the upward from your cecum to the inferior surface of the right lobe of your liver, which is turned sharply to the left, forming your right colic flexure. Kung makakita na mo, guys, or you encounter the word colic flexure na gani, that's basically means the turning or the turning point of each of these structures. Let's say, for example, for the ascending colon. Okay, so you have your right colic flexure, also known as your hepatic flexure. Because again, guys, if you encounter this word again, hepatic, this is particularly referring to your what structure? If you encounter hepatic, a word. Anyone? Hala, nara sa word o hepa. Okay, very good. It's your liver lover. Okay, your hepatic flexure. It's from your liver. Okay, so please take note na lang sa blood supply and veins. So transverse colon, so purely the continuation of your ascending colon, your transverse colon this time. Okay, located at the umbilical portion. Okay, it begins at the right colic or hepatic flexure and ascends to the left colic flexure this time. So you also have your transverse mesocolon, which spans the transverse colon from your anterior border of your pancreas this time. So proximally 2/3 supplied by these arteries right here. Please take note na lang, in the distal 1/3. So yeah, mga undercolic arteries. Okay, descending colon. So continuation of transverse colon lies on the left upper and lower quadrants and extends from the left colic flexure to your pelvic brim. Okay, so yeah, that's your descending colon. Then sigmoid. After ascending colon, you have your sigmoid colon. And then again your rectum. Okay, para di na ta madugay, guys. You just basically have this image right here. Asa si sigmoid colon diyang dapita, guys? Wala. O naa ba? Wala lang na. Asa dapita? Kani? Okay, di ba here? Okay, so here, your sigmoid colon, guys, take note here, di siya dapita yung sigmoid colon. For the arteries or arterial supply, okay, this was taken from your Tito Richards na. Take note na lang ani sa mga location and the veins. Now let's go to the accessory organs of the GI tract. So first, let's have your liver. So yes, it is the largest organ in the body and production and secretion of bile. It is also served as the involvement in many metabolic activities and considered as function for the filtration of your blood. Everyone, Are you aware or what is that condition if or what is that sign and symptoms rather that you can see your possible patient in the future na makaingon mo, I think na ay liver problem si patient.
Jaundice, sir.
Okay, very good. If that is what you called jaundice, unsa ni siyang jaundice?
Anong mag-yellow,
Yellowish skin, sir.
yellowish.
Mata o panit.
Mag-yellow ang mata o panit? Sure na.
Yes, sir. Sure.
Yes, sir.
Okay, very good. No, yellow you. Okay, so what if black si patient? Skin. So sa mata ha. So please, guys, it's not purely kuan guys ha. It's a case-to-case basis ha. Diba siya in your understanding or what you understood based on yellowing of the skin or the sclera of your patient. Specifically is the sclera. Sclera ka ng white, di ba? Hello? Oh. Sclera ha, it's not basically base na yung sabot niya, mag-yellow manggod, so significant yellowing of the skin. Okay, ang uban bitaw patient guys, again, if dili mo keen observer, naray siya mura og tinge nga yellow sa iyang sclera na. Or even the skin. I think familiar na mo ana, di ba? Wait, can you distinguish between loose pad and kana mag-yellow you or something?
Yes,
Hello?
sir. Mahalata ra, sir.
Loose pad is what, di ba? More on
Pale.
Pale, yeah, that one, pale. And then for yellow, mura na siya. Guys, as in kita jud ko, I saw this patient gid guys, as in guys, mag yellow gid guys, literal ilahang panit. Mura gid sila si Pikachu. Even ilang sclera as in. And then, yeah, please observe lang kay ang ubang patient dili kayo significant ang yellowing. Yes, mura na siya og kanang light. Sa sclera or sa ilang skin. Pero kung sa skin, general ha, kung skin, dili siya kuan guys ha, dili siya segmental or part or portion of the skin lang ni patient. Kaya basi niya portion lang, moingon na rin mo, oh my God, you have liver problem, ma'am. Diba? Guys, kabantay mo sa ubang bunog mo, yellow something sad siya. Mali mo na? Are you aware of that? Contusion. More siya mo yellow something sad. Like na yellow something ang portion sa skin. Hello?
Yes, sir. Sa
Anyone?
Yes, sir.
mga bundog nga makita sa kanang mga dugo nga babae, sir.
Kana. Diba? Naa. Okay? So, lahi na ha. Kaya basi niya mo, hala, patay na ako. Oh my God, na ako liver problem, Lord. No, nag-yellow na ako diring dakita. Nahimo na akong Pikachu, ingon si Sir Joms. Oo, so please ha, consider that. In general ha, ang yellowing sa skin ni patient. Okay, then further confirm if ang mata na, ang sclera na ni patient, ni yellow na sad. Okay, so inana. Then, yeah, there are a lot of things to observe, especially those females bitaw or patient nga mag-use og contacts. Oo, lisod bago na identify guys kung mag-use sila contact, especially aware mo anang dull eye nga contacts gamiton nila. Ang dako kay ba ilahang murag iris and all. Hello. Di ba murag mo cover na sa sclera? Hello guys.
Sir, unsa sir?
Ana. Dull-eyed nga contacts. Especially girls. Hello girls.
Yes, sir. Kakita, sir.
Karamin ana
Usually
so
sa cosplay.
kana sa cosplay, di ba dili kay pero dili not necessary cosplay because there are individuals man good guys nga mo prefer og use ana. Okay, so dili kayo bitaw visible ilang sclera kay mo na dull-eyed ilang gigamit, so kana. Okay, so please take note that as well. Kung dili kay makita sa ilahang skin. Okay, so for the parts of your liver, guys, it's either you have your right and left lobe. So purely, guys, your right is much more bigger than your left lobe. Okay? So, maura gid na siya. If dako nagay ka na nga portion, para ani, so that's your right lobe. Okay? Okay, compared with your left lobe. So, if you turn it upside down, so this one is inferior portion. So, this is your the parts of your liver na sadyo. So you have your caudate portion and your quadrate portion na nga sa parts sa imong liver. So you also have portal hepatis, which is a hilum of the liver that is found on the posterior inferior surface that lies between your quadrate lobe and caudate lobe. So please take note na lang or see it in the figure 5.7 in your Tito Richards now. Okay, so for the arteries and veins, That is purely for hepatic no word, which referring to your liver. Okay. So now we have your bile ducts. For the bile ducts, okay, this is secreted by a liver at a constant rate. If digestion is not taking place, bile is stored much more in the gallbladder and delivered to the duodenum during digestion. Okay, for the bile ducts, you have the following parts. You have your right and left hepatic ducts, common hepatic ducts, cystic ducts, and common bile duct. Kani siya, guys. Okay? So, bile for the hepatic duct. Okay, this portion right here is your gallbladder itself. Okay. So for the gallbladder, it's a pear-shaped sac on the surface of your liver, which again, you have the three parts. You have your fundus, the body, and the neck. For the basic function of your gallbladder, they serve as a reservoir for bile, which contains bile salts that assist in digestion and absorption. Okay. Then let's go now to the related conditions rather. Okay, guys, cholelithiasis means what? It's basically what? A condition. Okay, very good. It's your gallstones. Okay, gallstones na siya, guys. Your cholecystitis is the inflammation of the gallbladder. So if there's inflammation, if you encounter na nga mga itis na gani, guys, basically that structure right there is already inflamed. So if cholecyst is pertaining to the gallbladder and if there's an itis, so basically it's an inflammation of your gallbladder. How about your cholesterolosis? So it's based on the word itself, diba? So there's a cholesterol disposition within the stomach or the opening of your gallbladder. Okay, so dahil daghang fats diha dapita. Then for the cholangitis, it's just the inflammation of your common bile duct. Okay, your cholandocolithiasis. Okay, this is a common bile duct stones. Okay, so common bile duct stones. So for cholestasis, we have your bile flow suppression. Okay, bile flow suppression for cholestasis. Take note of that, guys, because again, these medical terms right here, related conditions right here, you may also encounter this in the chart ni patient later on in the practice. Cholangitis to. Sa gini, like unsa gini cholangitis so ana ba? So dili na mo mag-ingon ana. So automatic na naka-default na in your unsa ni in your own hard drive of your brain. Okay, 1 million terabytes. I hope na napapay 1 million terabytes sa inyong brain. Then dapita what is cholangitis and all. For you to be aware what are structures or si patient affected. Okay, now let's go to the pancreas. So both it consists of your exocrine and endocrine gland. So for the exocrine gland, they secrete enzymes that is capable of hydrolyzing proteins, fats, and carbohydrates. Again, guys, if your patient will not be able now to hydrolyze the protein, no? Kada mga meat yung ipangkaon, mga fats, and carbohydrates. Okay? What's the problem with patient? Anyone? Under exocrine. So there's a problem between the exocrine portion of the function of the pancreas ni patient. So what is that condition? Anyone? Again, what was that? Pancreatitis. Like, did I got it correctly? Pancreatitis. Exocrine. The patient cannot.
Diabetes dito, sir.
Okay, very good. It's your DM, guys. It's your classic diabetes mellitus patient. Okay, for the endocrine, okay, so you have the function of the islet of Langerhans here under your pancreas, which produces an no, bali di ay, guys. No, it's your endocrine di ay rather, guys. Okay, not exocrine na bali mo. So it's your islet of Langerhans that produces insulin and glucagon. That's your diabetes mellitus patient. Okay, here, kan siyang endocrine. Oh, yeah, endocrine. Okay, for the exocrine, what was that? What condition, guys?
Digestion.
Okay, very good. Okay, if you're not able to digest na, guys, bitaw kaning bitawng likaon mo nga meat, mga fats or carbohydrates. So basically, you have maldigestion, or you cannot digest properly your foods that you did take that day. Okay, or meat, for example. So for the parts, please take note na lang aning mga parts right here of your pancreas. So basically, it is just stating or describing, okay, the basic parts of your pancreas. Here, the head, neck, and the body, and the tail. So please take note na lang guys ha of the laterality ha. So I think it is more, you need also to take note that as well. Asa si head? Left ba or right? Sa mga inaana. There are two ducts under here as well. So you have your pancreatic duct and accessory duct. Okay, please take note na lang ani dire, the two ducts. Okay, here we have your spleen. So your spleen, pila ka po kayong spleen guys? Like how many spleen do you have? Like do you have 5, 10? Are you still human? Like you still here in?
Just one, sir.
Okay, just one. Ha, usara na inyong spleen. Ha, dili na duha. So it's a reddish largest, it also said as largest single mass of your lymphoid tissue, which is oval in shape and it has a notch on the anterior border, which is surrounded by your peritoneum by gastroepiploic omentum. If you can still remember, katong mga omentas, from the hilus down to the greater curvature of your stomach. It also consists your splenocoronal ligament, which connects from the spleen to the left kidney. Okay, so simplified ra kay guys ang blood and veins, blood supply og veins, no? Kay basin maglibog pa mo unsa gani blood supply sa spleen, so basin maghepatic pa mo no. So na same name ra gid applies guys, okay, for the specific arteries and venous drainages. So that will be your spleen. Now let's go to the kidney. So it's also provides the function for excretion of waste products, which is also known as urine, where it has your major role in controlling the water and electrolyte balance in our body and maintaining the acid-base balance of our blood. So your right kidney now is slightly lower than your left kidney. So there's also a median border that has a hilus on it that is serve as a passage for renal vein and consists of 2 branches of renal arteries, ureters, and 3rd branch of your renal artery. Okay, guys, what is the medical term for kidney stones? I guess, wait, unsay name gani sa specialist kamo kuan og kidney guys? Like especially if kanang mag-dialysis. Like, do you know someone?
Nepo, sir.
Ha?
Urologist, sir?
Neurologist ba?
Endocrinologist, sir?
Endocrinologist. Okay. So guys, it's your nephro. Okay? If maka-encounter na mo na guys, if nanagay bitaw sa notes ni patient dialysis, nephrologist, ano lagi nephrologist siya? Mas specialization nga doctor. So basically, ang affected ni patient guys is purely your kidney. Okay? So if naay kidney stones, unsay medical term for it? Uy, medical term.
Renal stones, sir.
Ha? I'm sorry? Renal stones, and what was that again?
Nephrolithiasis, sir.
Take it as a whole. Go. Unsa? Wait, not that one, guys. I think natin ni answer. Di lang kayo nako mag-get ang iyang answer. Like, what was that again? Nephro. Nephro what?
Yes.
Oh, yeah, that was. Yeah. Okay, it's your nephrolithiasis. Take it as a whole. Nephrolithiasis. Okay, nephrolithiasis. Okay, so mora na siya, guys. Okay, so purely kidney stones. Unsa ganitong gallstones? Bahala na ka, sir. Wala na, miss. Bye, sir. Good afternoon.
Cholelithiasis, sir.
Cholelay. Okay. Kana. Cholelithiasis. Okay, so that's it. Your gallstones. Kana lang, guys. Okay, so that's pretty much it. For the ureters, it conveys urine from the kidney to your urinary bladder. Okay, you have your renal pelvis. This is a funnel shape, expanded upper end of the ureter that lies within the hilus of your kidney. and it also have the there also stones over there, guys, in your ureter, which is also known as what?
Urethral colic.
Uy, ano guys? If mag-stone ang ureter. Ureter. What? Ureteritis daw. Oh my God, Lord. Huy, unsa?
Urethral colic, sir.
Okay, it's your ureteral colic. Hi, ureteral colic, guys. It's not your concert ureteritis ano daw? Oh my God, no, marag jumbled words na kita nilang dapita, guys. Again, so it's your ureteral colic. Okay, di guys, tinuod ni guys ha. There are patient kid, guys. I'm not sure, di ba? There, I think kuan sa ko usa ka student before nga naa siya like what was that? Like I think nagkuan to siya, bile duct stones. Yeah, na positive siya. Okay, nagpa-check up siya. Yeah, naagi ni siya ng mga patient guys. I don't know if you are one of them here, guys. Okay, kay naana sila guys ng mga patient ng mga stone formation. But ang ato moingon magutag stone, basically ato ang understanding or what we understood with regards to the stone itself. Kay murag okay, kidney stone. But there are parts of our other organs in our body that it can also be possibly nga ma-affected. Okay kana, pwede yang ureteral pwede yang uterus ra. Okay? So that's your ureteral colic or even the bile duct niya. So that's your cholelithiasis. Okay? So kana guys. Take note ang dapita. Okay, so here you have adrenal gland, you have your suprarenal gland here, and then your actual kidney, the renal pelvis in each of your kidneys, and then your ureter. Okay, so based on the function of your kidney, guys, diba? I don't know if you're aware, diba? There are here in the third world country that we are living, there are people who sell their kidneys. Guys, aware mo ana? Not all kidneys sa nila usarasan. Aware mo na, guys? Because of poor, because of being poor and all. So yeah, I think around, I'm not sure, like I think that was 300k. Same, guys. What do you know about the price? Like when you sell your one kidney, 300. Like that's a good amount already. Correct, guys? Hello. I'm not saying that you need to sell this time your kidney, but I'm just asking, guys, if you're aware of the pricing and all. Hello? Aware man na, guys? So yes, muna siya ang pricing, guys. I think I saw what was that? A documentation, yes, from GMA, endorser. No, I was just interested with that because like, oh my God, like most of that majority of that barangays who live there sell their kidney, guys. Like, oh my God. Like, normal nila, guys. Like, if you see them half naked, like, especially male individuals, normal na bitaw nila nga na ay cut. Have you seen that? Or it's just me? Kita mo na nga documentary?
Yes.
Like na ay cut sa ilang abdomen. Like, oh my God. Like, normal na sa ilang barangay, guys. Na ay cut. Like, they sell you their kidneys. No, rampantly. Ang selling sa kidneys ditong dapita. Like, oh my God. Like, then, sana lang imong kidney. So, yeah. Then, by understanding their not just their cost of living, but somehow their lifestyle, I don't think they will survive. No? Kay usa na lang ilang kidney and all. Kay napabayaan ni mga vices ang uban, guys. That's why they sell their kidney. So yeah, kana lang. So here, we have your suprarenal glands, which lies at the upper pulse in each of your kidneys, and it has the following parts. So you have your cortex and your medulla. Your cortex secretes the hormones such as your mineralocorticoids and glucocorticoids, and of course your sex hormones. Okay, your medulla this time is for your epinephrine and norepinephrine. Okay, so you have your right and left suprarenal gland. So your right is more pyramidal in shape and located at the upper pole of your right kidney, while your left suprarenal gland is more crescentic in shape, okay, and lies at the medial border of your left kidney. So dili siya tanan above reduced siya sa each of your kidneys. That's basically your right suprarenal gland. But when you consider your left one, that is basically at the medial border. okay, of the left kidney. So portal vein, so drains, this is just purely drains blood from the abdominal aorta of the GI tract, and drains blood from the following structures: your spleen, your pancreas, and your gallbladders. Then enters the liver and breaks into the sinusoid, which blood passes into the hepatic veins that joins the inferior vena cava. So please take note na lang aning portal vein, guys. Where is this exactly located? Okay. And then please take note na lang ani guys. Kay murag na kuan na ta sa time. I will draw on ta ko about this one for the lumbar plexus, but let's take it as a whole na lang later on your, let's say, we can maximize by the use of your laboratory or I'm saying, what's the next topic? Your pelvic wall and cavity. Yeah, after our midterm examination. Okay, so murag time na jud guys, no? So please be informed this time that you again guys, you have an examination this Friday. Unsa gani title sa exam? Hello guys.
Thoracic, sir.
Okay, your thoracic thoracic wall and cavity. And then again guys, we will have our laboratory session for this week. Copy?
Yes, sir.
Yes, sir.
Okay,
So,
sir.
magkuanta guys, sani? Sige to. Oh yeah. Back and spine and thoracic. Yeah. We'll have that later in our lab session. What else? Guys, please di ay ko ba? I'm not I'm not yet done what do you call this? Correcting your scores in our what do you call this? Canvas nga app based on your long examinations, no? Because some of your names also guys, please take time daw guys to edit. Like I can only see, I'm not sure if you're aware, like naabit ay numbers siya, and then nasa numbers siya, and then I actual names. Like I don't really understood that part, like why there are ano nga kisa ni si Bonsai, kisa ni si Bonsai, like who's Bonsai? Yeah, na pwede mga inaanak nga mga names. Please take time to edit that as well for me to include and input that later on in your grades, guys. Like I cannot, guys, if you don't have a name over there, yeah, kana lang. Kana bitong murag numbers nga long series of numbers. Aware mo na guys. Hello. Hello guys. Are you still here?
Yes, sir.
Please ko initan. Hello. Initan. Please ko in town message ha. In your GC to edit them guys, kay I will not be able to input your scores later on when you get to have your midterm grade and all. Again, if you don't have the complete family name first, okay, before your name, actual names, please. Okay, and then what else? Oh yeah, for the examining, oh yes, editing, so you have a question.
I was just gonna ask if there's a schedule sa midterms lang, sir.
Wala pa. I still haven't received yet the actual. I don't know pa guys. Sige lang, I will just message you maybe this week. I hope we can have that so that I can message you right away. Okay, and then please expect guys in your midterm examination, we will not have your kuanha. We will no longer have your what do you call this? Abdominal wall and cavity nga long examination. So basically, please expect, okay, there are a lot of questions, okay, here in this lecture today to your midterm examination next week. Copy? Guys, hello? Are you still there? Block A.
Yes, sir.
Oo. So expect more questions sa abdominal wall and cavity. Okay, the coverage again, it is from your basic anatomy until here. Okay, so and then please take note as well, I will not provide an answer key based on our your previous long examination that you did took already. So please study lang gihapon ta guys, diyan dapita. Laban lang jud, no? Oo. So I was still alive and kicking, Black A. Yes, Fardo.
Just to question, so Regarding bitaw sa complete anatomy application sir,
application. Yes, go Fardo.
Kanang when is there a plan for the school sir to renew our subscription?
Oh yeah, yes. Okay, noted, Fardo. Thank you for that question, Fardo. No, like I almost forgot about it. Okay, guys, with regards to your kuan, guys, pa, unsa gito yung name ano? Like what was that like? Elsevier? Elsevier? What was that? Elsevier something? Complete anatomy, right? Mo ba?
Yes, sir.
The Elsevier, so since it is already expired man, no? So our school again, we have the what was that? The Aklan Gross Anatomy something like it's another platform for us to study both here in HRN, guys, me as your teacher and you as a student. So it's a it's a it's not an app, it's something like it's a you need to browse it for you to clearly see the videos, okay, of the related structures here in our human anatomy or gross anatomy ng mga structures. So video siya, guys, na contains everything, bones and all. And what is although it will although it is more considered for me in my end, like I observe it more bitaw siya og kay taong old nga mga videos nga gi-explain and all, but it is more simplified. Okay, it is much more simplified compared bitaw sa katong previous one nga. It is much more advanced, but it is not considered user friendly, especially those people who don't have their tablets and all, or there's difficulty in opening or closing or basically in general using it with regards to the LCV or the previous app. So for the question, if naa na ba siya, so I already messaged our dean, okay, si Sir Cabasor about it, and he said that it's already a marabitaw trial pa, like it's not really a confirmation yet that they need to they now would like, or it is an ongoing purchase from the Veles College what do you call this, incorporation or something, like it's legit nagigess pa nga that we are given already the budget for them to take it kay murag I think that's the murag mao na lang na last nga mo lagi huwat na to, like the actual payment for it, guys. Copy, Fardo? Everyone? Hello?
Copy sir, thank you.
So if ma-purchase na to siya, of course, we will just definitely give you right away the exact what do you call this? Address. Okay, for you to browse it right away and then yeah, use it. Video siya, more on video siya. Ano lang siya, more on videos lang siya. Yeah, I think Raman Goro. Questions and clarifications before I get to leave this channel, guys, and say it. Call it a day, rather. Wala na. That's it na. Like, well, okay,
I think that's so far, sir.
Okay, I will. Everything is noted here based on the people that will not be able to get in this meeting. Again, guys, October na. And I'm very aware, fully aware, those people who are still not here until this day. Since the day, rather, that we started this semester. So, yeah. So, any updates from there, anytime, from these people? I think you're also familiar with these people. Naa. Naa, guys. It was so... I think, but sure na initan that everyone is included in the ASA members in your GC. Block A, under Block A. Yeah, aware na ko ato. Yeah. So please do, guys, kay murag alarming kayo na. And then yeah, your worksheet as well. Yeah, please do work for it, because again, if there is what they call this, if there's a lacking with regards to your examination and all worksheet, I don't think I'll be able to give you your material later on. So please work that as well. And then inform me, DI, please, anytime if na I can say who among these students who did miss or misses their long examination under sa to basic ana until sa to exam this week thoracic. Ha, if ever, if para na makuan later. Guys, ha, kana lang guys. Okay, so thank you for your time, everyone, and see you in your lab session this week. Thank you, guys. Bye.
Goodbye.
Thank
Thank you, sir.